Just imagine being consumed by darkness, hearing voices that aren't even there, and believing you are saving your child from harm, when in reality you are trapped in a nightmare of your own mind. This is the harsh reality of postpartum psychosis, a condition that affects thousands of mothers worldwide, shattering the expectations of joy and love that comes with childbirth. This is a very devastating condition that no woman should have to deal with simply because she brought forth life. Today, I will emphasize on the importance of understanding and addressing this condition. Everyday people deal with this condition as it doesn't choose its victims. One prominent case was that of Andrea Yates, which was documented in the early 2000s, who had come down with postpartum psychosis and as a result drowned all 5 of her children in a bathtub in their home. So you can imagine the magnitude of damage this does to women. Yet, there is so much silence surrounding it that many women don't even recognize the symptoms when they start to manifest. In an earlier video, I had talked about postpartum depression, which you can refer back to. But postpartum psychosis is a severe form of mental illness that occurs after birth. It is different from postpartum blues and postpartum depression. It is a psychiatric emergency, and as such, help should be sought as soon as symptoms are noticed. It is a severe mental illness which starts suddenly, within days or weeks after childbirth. It is characterized by hallucinations, delusions, confusion, paranoia, and basically a loss of touch with reality. It affects between 1 to 2 mothers out of every 1,000 births and usually happens few days to 6 weeks after childbirth. It can happen to anyone after giving birth, but there are some people who are more at risk of coming down with it, such as women with a history of mental health illness, previous episodes of postpartum depression or psychosis, a family history of any of these conditions. Other risk factors include first-time pregnancy with a previous family or personal history of bipolar 1 disorder, lack of sleep, hormonal fluctuations after birth, especially rapidly falling levels of estrogen. The symptoms associated with this condition are hallucinations, that is, seeing or hearing things that are not present or happening in reality, meaning the other people around you cannot see, feel, or hear these things that are happening to you simply because they are not really happening in real life, so you are just hallucinating. There are also delusions, that is, false beliefs that you hold on to so strongly even in the face of convincing evidence that what you believe is not true. Mood changes, which could either be mania or depression, insomnia, irritability, anxiety, paranoia, constant mood swings, feeling disconnected from your baby. Because this is a psychiatric emergency, immediate help needs to be sought once symptoms are noticed, as a woman is at risk of harming herself or her baby. The patient should see a psychiatrist, but currently there are no guidelines for management, but management depends on the cause. Medications to control acute psychosis is started, such as antipsychotic drugs, mood stabilizers, anti-epileptics, or lithium. Electroconvulsive therapy is also a means of treatment. A lot of support is needed from the family for quicker and better recovery, and patients should get enough sleep. With treatment, patients can recover quickly within few weeks, and without treatment, the patient further deteriorates. Women at risk should get specialized care before or during pregnancy and be seen by a perinatal psychiatrist. With all this being said, family members and partners should be able to recognize symptoms in mothers who have just given birth, especially those who are at risk of postpartum psychosis, and seek immediate help. Let us hold in our hearts the mothers who suffer in silence, and let us shine a light of hope and understanding. Let us break the stigma, foster empathy, and create a world where no mother feels alone in her struggle.